By June of this year, I had concluded that at least half of the people of Kampala had already gotten sick and recovered and were immune to COVID. And funny enough, I read in a newspaper that comes out of Kenya, the East African, one of the top people, the Ministry of Health of Uganda, Dr. Musonero, she said, you pick any 5 Ugandans, and 2 of them at least have already been infected and have recovered.
Wow.
I see the vast difference of how different social classes and their lifestyles are having different experiences with the virus. Yeah. The working class people, there's some of them that are scared too, right? There's fear everywhere, can't help it. And they have relatives who maybe even in the middle class, or their grandfather died or whatever. So everybody's been touched by it, but we've been touched very little. Count our blessings, and I'll talk about what those blessings are. But so far, only 3,250 Ugandans have died. Now, you may think maybe we haven't had anybody get infected. And officially, we've only had 127,000 Ugandans be infected. But I looked at antibody data from Zambia, from Kenya, and from Nigeria. And in all of those, it becomes really clear that there are hundreds of unreported or unrecognized infections that occurred for every official case. And it ranged from as low as in July 2020 in Zambia, there's like 90 something unreported cases. And then like in Kenya, it was like 250 or something in June of this year. In Nigeria in February is like 400 in the city and 700 in the countryside, unreported cases. So I figured, all right, let's do an estimate. Pick a mid-range number, because for some reason, and I'm going to get into what I think those reasons are, a lot of Ugandans already have been exposed to the virus, already have recovered and are already immune, and the number is very, very, very large. I made my estimate in June of this year, 2021, and figured that there must be like around 35 million Ugandans who've already gotten infected and recovered and are immune, whether or not it was a big deal or not. Maybe it was just sniffles. Maybe they had a headache or a tummy ache for a day or two. They didn't think it was that bad to complain about it because they know it. There's other things that are really bad that hit people. And so, a lot of folks, I think, and it could be that, even if they were really sick, no one heard about it. They didn't get to the hospital or clinic. Maybe they were scared to go to the clinic and that they would get even sicker. And so who knows? But for whatever reason, we have a whole lot of unreported cases. And when you do the math, by June of this year, I had concluded that at least half of the people of Kampala had already gotten sick and recovered and were immune to COVID. And funny enough, I read in a newspaper that comes out of Kenya, the East African, one of the top people, the Ministry of Health of Uganda, Dr. Musonero, she said, you pick any 5 Ugandans, and 2 of them at least have already been infected and have recovered.
Wow.
And so they didn't put that on the front page, I guess, because, I don't know why. In general, I think a lot of countries haven't wanted to talk about herd immunity. And so I've thought about that from the beginning. And, from when I modeled back in March 2020, April, I guess, when I estimated how many Ugandans might die if there were no vaccines, no medicines, no ventilators, just nothing was done. If we just looked at Italy and North and South Korea, I figured we would have 5,000 to 6,000 dead maximum. That was my death prediction. So far, we've had 3,200. Kenya's had almost 5,000 or around 5,000. So What does that really tell us? I don't know. But I think the reality is Ugandans are young and young. I'm talking real young. This is the youngest country on earth. 90% under the age of 40. And they're active, they're fit, they walk to work, they do hard work for a living. They're out in the sunshine, which is giving their body vitamin D, and vitamin D is what they give you as medicine when you get COVID, right? Because vitamin D helps your body strengthen its immune system and balance the immune system. So sunshine is a medicine, right? And the Ugandans are walking in medicine all day long, right? And they're keeping fit and active. Their lungs are working, their heart is beating, their blood is circulating, you know, and they're interacting with each other. Because it turns out, I mean, being exposed to each other's infections actually helps to protect us. And, you know, COVID isn't the first coronavirus, right? There are 5 others that give us flu and cold every year, right? So that's the other interesting thing. It's, again, the poorer people, because they don't have the luxury of having like one toilet per person or one or 2 per family, they may be sharing one toilet with 100 people. And so they're breathing each other's stink, and their stink actually has virus particles in it. So even when someone's sick with the cold, your neighbor is actually not only spreading it to you potentially, but he's immunizing you. You know, and so it's like you're giving your body the memory T cells that recognize more distantly related coronaviruses like COVID. And so this was revealed back in May by the Scripps Institute in California, where they talked about how memory T cells actually gave people immunity to COVID. And then Duke University, along with Singapore, showed that when they looked at old blood samples long before SARS, and it turned out when they exposed those blood samples to SARS, they already were immune to it, like half of all the samples. So it's like, it's a fair assumption that a quarter to half the people everywhere probably in the world we're already somewhat immune. And that's why I think we also need to think about this stuff a little differently. People try to talk about immunity and infection as if it's 1 or 0, as if it's a binary condition. No, you can be slightly infected, you know, and, you know, the dosages, how many sneezes, you know, did somebody put onto you? How many times did you, you know, rub your eyes with virus particles on your hand? And then, you know, it's like, so how infected are you and how immune are you? Right? There's degrees of immunity, and the immune system is very complex. Some people say it's as complex as the human brain. And so we like to act like we know everything, and we know a lot, but of course we're learning a lot more. We learned in the course of this crisis that memory T cells really matter. And probably T cell testing is what we should do so that we don't have these fights over vaccines versus infection-based immunity. Because in the end, it's the memory T cells in our bones, right? It's in our bones that our bodies remember these infections. And it's that serious, right? When you're faced with these infections, it's burned into our bones. Our bone marrow is where our body produces its memory T cells. It's where it stores them. And so yes, your antibodies are gonna wane, no matter what. They wane for every disease. And it appears that in about 6 months, they wane even if you were infected. So whether you're infected or injected, your antibodies are going to wane over time. What seems to last a lot longer are the T cells. And so that's probably what the type of testing should be done to find out the truth. How many people truly were infected, how many truly have developed some degree of immunity. What's interesting is vaccines are a technology that came from Africa. It's an African invention. No one wants to talk about this. I don't know why. They don't talk about it in the Western world. They don't talk about it here. From what I know from studying history, there was a slave in Boston named Onesimus, and they had a smallpox outbreak. And so he showed them what they did back home in West Africa,